this will get over before too long. Hopefully in the next couple of months or so. And then college will hopefully be normal for you.
I hope so.
So, well, cool. Well, hit me with it. But
Okay.
now, I told John this. I said I'm an orthopedic surgery resident, so I'm still in training. I'm not finished with everything. I did college and then medical school, and then I'm in residency right now. I have 3 years left of residency. So
Okay.
I don't know if I have to have an actual attending, like a real doctor. I mean, I'm a doctor. I'm not like a officially done doctor. So I just
It's
wanted
fine.
to preface it.
Yeah, you're
Okay.
good. Okay.
Cool. Hit me with it.
Who are you and what do you do for a living?
So my name is Jeffrey Reese. I'm an orthopedic surgery resident. So basically, we do everything from fixing fractures to hip replacements, knee replacements, all the way down to hand surgeries. We cover a broad spectrum. Right now, things are a little bit different with the shutdown. Our elective cases are shut down.
Mm-hmm.
So we're just doing fractures. So like today, for example, we had a distal humerus fracture or an arm bone fracture that we fixed. And like femur fractures, hip fractures in the elderly population especially, that still occurs because they're still walking around, falling, and that sort of thing. So we're basically the carpenters of the surgeons because it's bones, right? So we're fixing bones, putting them back together. It's hammer, saws, and drills that we use in the operating room to fix bones and make them work again. So it's the most exciting realm of surgery, for sure.
So what made you want to become a trauma surgeon?
So when I was in medical school, it's probably my second year of medical school. First year of medical school when we did anatomy, I think that's when I realized I really enjoyed dissecting. I like using my hands, and there's no better way to see God's creation than to be fixing things that have been broken. So that's when I kind of knew I wanted to do some sort of surgery, and then during my third year of medical school is when I settled on going into this route. And no regrets. I love it.
Okay. What school or schools did you attend to get your degrees, and how was medical school?
So I actually went to a really small college for undergraduate work back in Pensacola. I'm from near Pensacola, Florida. I went to Pensacola Christian College. It's a very small school, probably 4,000 students, 4,500 students. It's a little bigger now. Mm-hmm. Then I went to medical school at Florida State University, and I had 120 classmates there per year. What was the second part of that question you asked me?
How was med school?
How was medical school? It was an adjustment. So I think it's like anything else. When you have a different environment that you're in, you have to kind of adapt to that new series or that new form of learning. It was much higher paced than college. Mm-hmm. I would probably learn in one day what I would learn in a week in college. So it just was really accelerated. So all your free time was spent studying. It was busy, but it was manageable.
Okay. So what is an average day at work like for you?
It varies, but an average day is probably getting up at 4:45, go into the hospital, round up my patients. If I'm not on call that day, we take 8 call shifts a month. So if I'm not on call, those are your good days. So like when I was on trauma, before all this started, you would typically, that's one of the busier areas of orthopedic surgery. You typically wouldn't be done before 6 o'clock in the evening. And then sometimes you still have to go post-op those patients, so you go back to where those patients were. After they finish surgery, they go back up to the floor, you go check on them, because they're oftentimes big surgeries, like a hip fracture or something like that. And so you just go post-op, check on them. So typically I'd get home probably by 7:30 or so. And then I'll study, because I have my in-training exams. and then study until you fall asleep. Rinse and repeat.
That was kind of the next question: is what hours do you usually work, and how often are you on call?
Yeah, so we work. Like I said, I have 8 call shifts a month. Typically, they're starting to drop it back down to where 7, so they're sharing some of the call. Still a lot of call.
Mm-hmm.
And it will vary. You're supposed to average working about 80 hours a week per ACGME requirements. So, yeah, that's pretty much it.
So, what's the best part about your job?
I think a lot of the reason that I went into surgery, or orthopedic surgery especially, is it's not instant gratification, but it's a shorter turnaround than managing diabetes.
Mm-hmm.
If I went into family medicine, I'd be trying to get a patient's hemoglobin A1C down from 8 down to 7 or 6.5, and that's great, but it takes months, even years, to be able to make progress, typically. For us, we can fix a hip fracture or something, and a patient who literally can't walk can now walk, out through her mailbox or something like that, or a hip replacement is very satisfying because, post-op day 1, the patient's getting up and walking around the room,
Mm-hmm.
and it's very satisfying to know that you get to have a small piece and making their life a little better.
Yeah. Now, what's your least favorite part about the job?
The hours. Not being able to sleep much. That's life. It gets better as you go along.
Mm-hmm.
But definitely the long hours is the least favorite part, being away from home, not being able to see the family as much. But as overall, I have no regrets. I know I'm doing exactly what God wants me to do, and I really overall really love doing what I do. So I just don't like being tired.
Do you have any regrets about choosing this career?
It's like I read your question.
Yeah.
No, I don't. So there are times. Obviously, there's downtimes when you can get a little bit discouraged when you're working a lot of hours, and get very tired and run down, and there's always stuff to do. But I really don't have any regrets. If God hadn't called me to be a doctor, I probably would have been a farmer, because I love farming. I grew up on a farm. I loved it. It was great. It was a great lifestyle, and I really enjoyed that. But I don't think I would have been able to meet as many people as I have, and hopefully been able to have an influence in their lives in a good way, I hope, than if I'd have been a farmer. So, yeah, no regrets.
Okay. What skills do you find are most critical for this job?
That's a tough question. I think work ethic is probably, would you consider that a skill? I don't know. Work ethic is probably the most important thing, because when you get fatigued and run down, you can try to cut corners, and I've certainly not been perfect at it, but I think trying to maintain a good work ethic is really important. Skills, I guess the basics, that hand-eye coordination is a good thing. Finger dexterity for suturing or whatever. If I had to say a skill, I'm gonna change that a little bit to character trait. I think work ethic is probably the most important thing that you can have, because that is more important than a high IQ or anything. I can't control how smart I am, but I can control how hard I work. So that's probably the most important thing.
Okay. And lastly, what advice do you have for someone like me wanting to go into this field?
I think getting some shadowing experience. So working with whatever you want to go into, trauma surgery, heart surgery, orthopedic surgery, you name it, getting into a position where you can shadow or spend some time with some of those people, so you can actually see what it's like. Because if you're just going to go into it based off of, Grey's Anatomy or whatever TV show, you name it, it's not going to be as realistic, obviously. And you can kind of see the ups and downs, because you don't want to just see all the good or all the bad. You want to kind of see a mixture. You want to see a realistic picture of what it's going to look like. and then draw from that realistic expectations. So where am I going to project myself 15 years from now? I always tried to implement a 5-year plan, anticipating where I'll be 5 years from now. So back when I started medical school, I was already anticipating residency, or back when I started college, I was already studying for my medical college admissions test. Keeping that in mind, that you can gain information from people who've gone before you, have a 5-year plan or more, and then execute it, and don't let little obstacles get in your way.
Okay. Thank you so much.
No problem. Yeah. Do you know where you want to go to school?
I'm going to Washington University in St. Louis.
Wash U.
Yeah.
All right.
See, no one ever knows Wash U.
Wash U's like, they have like one of the best orthopedic programs in the country. Wash U's awesome. How'd you end up going there?
So my dream was to go to Stanford. So I went to an informational meeting in Baton Rouge about Stanford, but Wash U was there too, and they had a little presentation, and I was like, no, I'm going there. So then we went tour last year, and it was just, I loved it. So I applied ED and got in, so, yep.
That's awesome. That was really cool. I've got a buddy who I think is at Wash U for anesthesia. And, I mean, it's a great, obviously you're extremely smart if you're debating between Stanford and Wash U. That's really, really outstanding.
Yep.
So good for you.
Thank you. All right. Have a
All
good
right, if you
day.
need anything else, holler at me, okay?
Okay. Thank you.
All right, goodbye.
Oh, that was